Hi, everybody. My name is Desiree Berry, and I will be discussing using a nurse led to phase intervention to prevent teen suicide. Teen suicide is a significant public health concern, considering it is among the leading causes of death among young people. Suicide happens when teenagers or whoever individuals in general cannot cope with daily life stressors or face challenges throughout their regular day. When individuals cannot put up with challenges they face, they're likely to consider just taking their lives. Um, the case is worse for teenagers who are in their adolescence and they face major setbacks trying to fit in and adjust appropriately to changes that occur in their everyday lives. Teen suicide devastates families, communities, and adversely affects population outcomes, yet it is preventable. Nurses are a crucial role in preventing teen suicide, primarily through direct patient interaction with patients in clinical settings. They can identify at risk teenagers and implement a raft of strategies that eliminate these suicidal thoughts and prevent them from taking their lives. My report presents a project that is a proposal to determine the effectiveness on a nurse led two phase intervention in preventing suicide among teenagers. Suicide rates among teenagers have recently risen, raising concerns about the potential impact on families, communities, and society. According to a recent report by the University of California, Los Angeles, suicide is among the second leading cause of death among people ages 15 to 24. According to the report, about 20% of the high school students report having severe suicidal ideation, and approximately 9% of these students have actually attempted to take their lives. And this was reported by the National Alliance of Mental Illness in the same report. The cost of suicide in the country is more than 900 billion annually. This is a loss in productivity and medical expenses. So um, it's very crucial to explore some of the strategies that can be used in preventing suicidal ideation among these teenagers. Um, the critical role of nurses is to identify these high at risk teenagers and implement appropriate interventions to prevent this from happening. So, the project's purpose will be to determine the efficiency of such an intervention. According to Halero, suicide is a leading cause of death in the general population. Unlike other causes of death, suicide is a conscious or subconscious decision that people make. And again, this is when individuals cannot cope or stress with everyday stressors, challenges. This can include a variety of things. It could be a death of a family member, financial, job loss, relationship issues. It can extend to medical diagnosis. And these are things that happen in our everyday lives. SAMHSA recognizes the critical role of nurses in identifying these at risk patients and implementing appropriate interventions. So, nurses interact with teenagers facing different problems. The nurses must conduct an extensive assessment to help develop comprehensive care plans to provide help to these patients and overcome and cope with the stressors that they face. It's very crucial to prevent teen suicide due to its adverse impact on families, communities, and society. Given nurses' expertise, it's the direct contact with at risk patients. So, nurses are a better place to help mitigate these devastating outcomes. My problem statement for this report was in teenagers, how does nurse led to phased intervention compared to no intervention affect suicide rates? Findings by America's Health Rankings distinguish suicide as the second leading cause of death among people, and they age range was 10 to 34. These findings are supported by a 2023 report by UCLA, and several other studies on teen suicide. Researchers have extensively studied the best interventions that can be implemented to address the problem, primarily from a clinical perspective. Nurses are the ones who should determine the best strategies to help people cope with stressors and overcome suicidal thoughts. So, first, nurses must conduct extensive assessments to establish at risk teenagers. Various methodologies, including approved assessment instruments, a PSS-3 survey is a patient safety screener survey, and this can be used to identify patients with suicidal thoughts. So, once these patients are identified as high risk, their care can be tailored to address their specific needs and overcome suicidal ideation. Nurses provide a safe space and supportive environment for these patients where they can get the necessary help that they need. There is an increased need to implement nurse led interventions in preventing suicide. The proposed intervention is founded on the need to address the specific risk factors for suicidal ideation among these teenagers. Um, the plan involves implementing a nurse led two-phase preventative solution to identify these at risk youths and initiate collaborative ways of helping them cope with these stressors. Teenagers face many challenges navigating the adolescent environment, which adjusting to changes and associated with social pressures due to the increased depression and associated symptoms, they will most likely seek medical care at the hospital. Mainly, the proposed intervention will boost the resilience in these young adults and expand their social support for better coping with adversity. The role of the nurse's primary involves assessing and working with patients collaboratively into helping them avoid the suicidal ideation. Working together side by side can help prevent suicide and improve resilience among teenagers. It is imperative to recall that the proposed intervention entails a two-phase nursing solution in identifying helping at-risk teenagers develop resilience towards daily stressors. Implementing this proposal will begin with rigorous training and development programs for nursing staff. This will make sure the nursing staff is equipped with the skill and knowledge that they need to identify these patients when they are assessing. This training initiative seeks explicitly to refine nurses' behavioral health competencies and prepare them for the task ahead. Phase one of the proposed intervention requires nurses to conduct extensive risk assessment for teenagers in the hospital. And this starts with the emergency room. So patients can come in for anything, and they have this assessment tool that will flag if they are high suicidal risk. So from the emergency room to different floors of the hospital, all the way to the intake lobby of the psychiatric ward. The PSS-3 instrument is what it's called, is a tool to establish at-risk teenagers. It has three main questions on depression, active suicidal ideation, and lifetime suicidal attempt. This tool has proven efficiency and it's very simple to administer and execute in a clinical setting. So it's done just by talking to the patients. It takes no more than 2 minutes per patient. The risk assessment helps identify teenagers who are more exposed to factors for risk factors for suicide. The second phase entails the nurses developing collaborative and communicative therapeutic relationships with the patients. And this goes back to our roots in the nursing profession in general. Um, After identifying at risk patients, the nurse deploys their care skills by establishing a collaborative, communicative, and therapeutic relationship with the teenagers. Through these relationships, we can provide that emotional and safe space and supportive environment so the patient can get all the necessary help that they need. The nurse can determine the best psychiatric or psychological care approach for which they can refer the patient for more standardized care. The proposal's expected outcome is reduction in teen suicide rates and the associated risks. Primarily through the nurse led two phase intervention, there should be a reduction in suicidal ideations among teenagers, and the target population group should have an improved capacity to deal or cope with life stressors and challenges. So we'll have a pre test and then a post test assessment format, and this will be used to establish the impact of the intervention. This assessment involves comparing pre-post intervention data to determine any differences. The PSS-3 survey instrument, this can be used solely for this purpose. The Patient Safety Screener Survey is a brief tool to detect suicide risk, and the tool assessment asks three main questions. So, over the past 2 weeks, have you felt down, depressed, or hopeless? Over the past 2 weeks, have you had any thoughts of killing or harming yourself? Have you ever attempted to kill yourself or harm yourself? These questions will be asked to teenagers as a part of the assessment in the emergency room to establish the risk of suicide. And identifying at risk teenagers will be subjected to nursing intervention for their stay in the hospital. At the end of the intervention, the tool will be used again to determine the risk of suicide among teen patients. And the data obtained at the end will be compared to baseline data to inform subsequent action. And the only limitation of this evaluation plan is the potential lack of sufficient data to draw exhaustive conclusions. The project's findings will be all compiled into a report that can be disseminated through nursing conferences, press releases, and online through dedicated portals and social media platforms. The plan is to formally write the editor of a professional nursing organization to consider publishing the project, and this will help for the greater educational outreach. However, I will begin by writing a letter to my supervisor requesting contact hours for continuing education. I will also write my chosen expert nurse practitioner asking them to review the findings and also help in disseminating them. Her role will be to help me guide me through the process and also direct me in the proper steps in order to publish the report. I do look forward to further engagement about the project's findings. I'm hoping to contribute immensely to existing knowledge on teen suicide prevention and also the role of nurses. This report presents a research proposal exploring evidence based strategies nurses can use to prevent teen suicide. As existing data and research findings render teen suicides a significant public health concern. Beside the rising prevalence of teen suicides, it is crucial to note the devastating effects on the quality of life in societies and deters population health outcomes. Teens face various adolescent related changes and other stressors that can push them into suicidal ideation. This proposal explores the practicality of a nurse led strategic intervention in preventing teen suicide and lowering the teen suicide rate. The success of the proposed intervention will be a significant step towards enhancing the quality of life for teenagers and reducing preventable deaths among young people. Again, my name is Desiree Berry. I do thank you for you guys' time, and I hope you enjoyed my report on using a nurse led to phase intervention to prevent teen suicide.